And action. Nancy had a question about cutting down, getting lean, getting ripped. Those are all terms used in the bodybuilding community for trying to cut down or burn off your fat. So this is what happens. When you're in bodybuilding, typically you want to do exercises during the majority of your year leading up to the competition so you can develop size. You can work on your weak parts. You don't care too much about the fat load or your percentage of body fat because you're just trying to get big. And then about a month to 6 weeks before competition, you try to go a little cardiovascular, change up your exercise routine, don't lose the bulk, but try to exercise so you're burning fat. And also obviously changing the diet so you have a leaner and decreased calorie count. That's the problem. Well, the benefit for that, for bodybuilding, is when you're on stage, the less body fat you have, like 3 to 5%, the more muscle striations show, especially when you're on stage and you're trying to hit the poses, and it kind of looks deeper. It's more defined, and judges will look at you differently. Now, I know most people aren't into bodybuilding, but the guys like getting on the beach and talking about six-packs and triceps and biceps and all that stuff. But if you're just trying to lose weight and get lean, well, it's tough to do, obviously. There are formulas. If you can get to a registered dietitian or somebody that's really good as a nutritionist, you can calculate basal metabolic rate through a series of formulas, and you get what you're supposed to be putting in to maintain, just like breathing. I talked about this before. Breathing, activities of thinking, and activities of whatever you do for work. And then you try to chop that down even further by taking that, whatever calories you take in for just maintaining life, exercise more than that over and above, and hopefully you'll burn whatever excesses you have stored and not crash. But the problem is when people cut and go lean, the challenge is if you cut and go lean and you're decreasing your fuel source. And if you decrease your fuel source while keeping up an exercise routine that's real strong, you could starve your muscle and have a problem with injury. Remember, when you exercise, you want to build up exercise, muscle, strength, velocity, force, so that you overload muscle. When you overload muscle, you have minuscule tears in the tendons. And then when you repair that overnight or over the next 48 hours, you have a stronger tendon and a bigger muscle. More muscle fibers, bigger lift the next time, and more mass. So you can get hypertrophy of muscle tissue and look big. You can't really get hyperplasia. You can't build more, you can't develop more muscle, you just get the bigger ones. And then the opposite also happens too. If you don't do anything because you hurt your back and you're just lying flat in bed, you can lose about 20% of your muscle strength, say for the quads or the biceps, by not doing exercise for 1 week. 20% loss. So you can imagine the guys that have injury, they lose muscle strength and muscle size very quickly. So that's why it's so important. Muscle can respond, but if you push it too hard and you don't get enough fuel sources during the time that you're kind of cutting down and getting lean, you might get injured. So you have to pace yourself with that. They have a lot of patients that kind of blow through. They'll cut down. I have a patient that goes on the HCG diet. So the HCG diet gives you a hormone. You get a hormone from a weight loss doctor, and during that month that you're on the hormone that you're injecting on your own, you cut back to 800 calories a day, which is ungodly. That's what I used to do when I was bodybuilding. 1982 at Attila's gym, I entered Mr. Natural New Jersey, and I was a teenager, 18. I didn't eat properly, but I was living on my own. Well, I was actually living with 2 bouncers and a bartender at one of the, I think it was called Stardust nightclub. And I was just working 3 jobs. I ate tuna fish. That was about it, I think. And I drank alcohol, and I probably got rid of all the extra fluid the next morning. But I was born lean. I was born thin. So when I put on muscle, I had an advantage. I didn't have to cut down. So that's a positive, but at the same time, it could be a negative because it's when you're thin, it's harder to put on muscle mass. I was just lucky I got the trainers at Attila's gym to show me, the owners to show me, Brian and Joe or whatever his name was. But With the right training and with the right guidance, you can always continue with building and cutting and maybe changing or manipulating your diet. I've always talked about working on your macronutrients, so at least, even if you cut down total calories and carbohydrates per day, you maintain the protein so you don't lose too much muscle mass. Muscle needs protein. I like the work out of Canada with the exercise physiologists. I think it's important to maintain, but it's a give and take when you're trying to cut down. So I guess it also depends on why, Nancy, why we're trying to cut down or get lean. If we're doing it just for health, that's fine. But if we're not in a hurry, do it properly so you don't get injured and get some help. So hopefully when we check our blood test, I'll look for deficiencies. We'll kind of come up with an idea. You give me a 2-week diet diary. I'll see how I can manipulate it. And then most of all, I'm going to be only seeing my patients every once in a while, touching base, repeating blood tests, seeing where we are. But I think having somebody do eyes on and you being accountable to somebody can kind of push you, redirect, redesign, push harder, decrease when it's time. That's the value of a coach. So having somebody keep eyes on you while I keep eyes on you, you'll have a winning team. In addition, you got to maintain sleep. So during those times that you go lean, your brain's going to think starvation. It might be an issue with sleeping, and that's why it's important. I don't suggest it to everybody, but I think supplementation during those times when your body's going to be thinking starvation, fight or flight, it's important to calm. It's always good to have a calming practice, but if the sleep is interrupted, you're not going to get anywhere. You're going to injure yourself. So that's why supplementation like valerian, 5-HTP, melatonin, all that stuff helps. Magnesium at night, all helps. So hopefully this gives you some answers, Nancy.